Welcome back to the Parkinson's Education Podcast. In today's episode, we're tackling a question that comes up again and again. How is Parkinson's disease actually diagnosed? This is something many people living with Parkinson's have wrestled with during their diagnostic journey. Some listeners may have gone through several of the tests we'll be talking about today, while others may not have experienced any of them at all. Either way, we're going to break down the different methods doctors use to identify Parkinson's disease and how they work to distinguish it, at least to some degree, from other conditions that can look similar. In recent episodes, we discuss Parkinson's disease alongside atypical forms of Parkinsonism. A number of the tests we'll cover today are designed specifically to help tell those conditions apart and rule out disorders that resemble Parkinson's but don't progress or respond to treatment in the same way. I hope you'll stay with me through the end of this episode to get the full picture. And with that said, let's head into the intro and get started. Welcome to the Parkinson's Disease Education Show, where we break down the science, clear up confusion, and help empower you as a person living with Parkinson's to reach your fullest potential. Everything shared on this show is for educational purposes only and should never replace advice from your personal medical or therapy providers. If you haven't already, consider subscribing. And if you're looking for a more tailored experience, ask us about our membership options. Now, let's jump into today's topic. Let's begin with how Parkinson's disease has traditionally been diagnosed. Until fairly recently, diagnosis relied almost entirely on clinical evaluation. That means a neurologist would review a person's medical history and closely observe physical symptoms. This includes assessing movement-related signs such as slowness, muscle stiffness, balance issues, walking patterns, and coordination tasks like rapid hand movements or alternating motions. When these observations were combined with a positive response to levodopa, physicians often felt confident diagnosing Parkinson's disease. There is also a standardized scale used worldwide to both diagnose Parkinson's and evaluate its severity. This is known as the Unified Parkinson's Disease Rating Scale, commonly referred to as the UPDRS. The scale is divided into 4 main sections that measure different aspects of life with Parkinson's. The first section focuses on cognitive function, behavior, and mood. The second looks at activities of daily living. The third is a detailed motor examination, and the fourth addresses motor complications and how symptoms respond to treatment. Together, these scores are used to assign a stage on the Hone and Your scale, which ranges from 0, very mild symptoms, to 5, which represents severe disability. As I've mentioned in previous episodes, which I'll link here, these stages are somewhat subjective and are mainly used for research and treatment tracking. They're not fixed labels. Someone classified at a higher stage can sometimes move to a lower stage with intensive therapy, medication adjustments, or lifestyle changes. Disease progression also varies dramatically from person to person. Someone who has lived with Parkinson's for 20 years may never reach the later stages, while another individual might progress more rapidly within just a few years. In both cases, targeted therapies like LSVD-BIG, medication management, and lifestyle interventions can make a significant difference. While the UPDRS is incredibly useful, it isn't always precise enough to definitively confirm Parkinson's disease. As we discussed in a recent episode, atypical Parkinsonian disorders can closely resemble Parkinson's but respond very differently to treatment. That's why additional diagnostic tools have been developed to improve accuracy and reduce misdiagnosis. One such tool is the DaTscan, an imaging test that allows doctors to visualize dopamine activity in the brain. DaTscan stands for dopamine transporter scan. It involves injecting a small amount of radioactive tracer and then performing specialized imaging to see how dopamine is being absorbed. In a healthy brain, dopamine transporters appear bright and well-defined. In Parkinson's disease and similar conditions, these areas appear reduced, thinner, or significantly dimmer. This can help confirm whether a dopamine-related disorder is present. However, the DaTscan alone cannot distinguish Parkinson's disease from other forms of Parkinsonism. In a healthy brain, dopamine transporters appear bright and well-defined. In Parkinson's disease and similar conditions, these areas appear reduced, thinner, or significantly dimmer. This can help confirm whether a dopamine-related disorder is present. However, the DaTscan alone cannot distinguish Parkinson's disease from other forms of Parkinsonism. That's where biomarker testing has made a huge impact. One of the biggest advances in recent years involves detecting alpha-synuclein, a misfolded protein that accumulates in Parkinson's disease. These protein clumps are found in the substantia nigra of the brain and in nerve tissues throughout the body. Parkinson's disease is classified as a synucleinopathy, meaning alpha-synuclein is a core biological marker. Other conditions, such as Lewy body dementia and multiple system atrophy, also fall into this category, which is why no single test can be considered 100% definitive. One of the earliest biomarker tests is known as the SYN1 test, which uses small skin biopsies to examine nerve fibers beneath the skin. These biopsies are typically taken from 3 locations, commonly the neck, thigh, and ankle. The presence and distribution of alpha-synuclein across these sites helps estimate the likelihood of Parkinson's disease or a closely related condition. More recently, another test has become available through a lumbar puncture, allowing doctors to analyze cerebrospinal fluid for alpha-synuclein. This fluid circulates around the brain and spinal cord, making it a valuable source of information. Even with these advancements, diagnosis still relies on a combination of clinical evaluation, rating scales like the UPDRS, and diagnostic testing. There is no single test that can absolutely confirm or exclude Parkinson's disease in every case. That said, the SYN1 skin biopsy has shown very promising results in internal studies. According to company data, it demonstrates extremely high specificity and sensitivity, meaning it is highly accurate at identifying both positive and negative cases. However, as with any internal research, independent validation is still important. One exciting development on the horizon is the possibility of a blood test for Parkinson's disease. I recently came across a UK-based article from June 2024 discussing research supported by the National Health Service. This test would analyze multiple proteins associated with Parkinson's, potentially identifying the disease before symptoms even begin. The goal would be early intervention, protecting dopamine-producing neurons before irreversible damage occurs. While this technology isn't widely available yet, it represents a major step forward. And let's be honest, a simple blood test is far more appealing than spinal taps or multiple skin biopsies. That brings us to the end of today's episode of the Parkinson's Disease Education Podcast. I hope you found this discussion helpful and informative. Let me know in the comments if you've ever experienced a delayed or incorrect diagnosis and whether advanced testing helped guide your treatment. Before we wrap up, I want to thank the companies that support this channel. Using the links provided helps us continue creating content at no extra cost to you. I especially recommend Kazik Shoes and Comfort Linen, which offers 15% off through our link below. Thank you for spending your time with me today. I truly appreciate it, and I look forward to seeing you in the next episode. Until then, stay informed, stay proactive, and stay empowered.